health problem that makes it hard to breathe sometimes, just like you said. Some people say that having asthma can sometimes feel like you are breathing through a straw. No one really knows what causes asthma, but asthma can be triggered by a lot of things. We talked about those triggers. Common triggers that can cause my asthma to act up is cigarette smoke, pollen, pet dander. I know you guys talked about your dad has an allergy to cats. Pet dander, pollutants in the air, having a cold, weather changes, and some exercise. When my asthma is triggered by any of these things, it causes me to sometimes have an asthma attack. During an asthma attack, my chest gets really tight and I begin to wheeze. When I am having a hard time breathing, mommy gives me a special treatment using a special machine called a nebulizer, and I feel much better. Or an inhaler like we see on the video. When the treatment is over, I always make sure to brush my teeth and rinse my mouth out really good with water so that I do not get sick. So anytime you have to take an inhaler or you have to take the medicine through a nebulizer machine, that special machine I just showed you, you always want to make sure you wash out your mouth, because when you don't wash out your mouth, it can cause different infections. The medication can actually cause different infections. The medicine can make me feel really hyper sometimes, but most of the time I am okay. So the albuterol, which is the special medicine that's used to open those airways, if you are having chest tightness, will open them up, but it'll make you kind of jittery and very, very excited.
Makes your heart fast.
Makes your heart beat really, really, really fast. In order to prevent me from having an asthma attack, I take regular medicines, eat right, and drink lots of water. It's very important for those that have asthma to drink lots of water and pay attention to diet and exercise. And sometimes food can even cause asthma attacks. All right? Every day to stay healthy and strong. It is really important to take your asthma medication every day to keep your lungs healthy and free from asthma attacks. I have an asthma calendar to help me remember to take my medicines every day. So this is, of course, after you've been diagnosed with the disease and you've spoken with your doctor or your pediatrician and have given you medicines, special medicines to keep your asthma under control. I take a corticosteroid every day. This is a maintenance drug and keeps me safe from frequent attacks. So Maya is taking this inhaler. It looks like an inhaler. It's actually a maintenance drug, all right, that she takes so that she doesn't have frequent attacks. And this is something that can be prescribed from.
Is that like Advair?
Yeah, like Advair,
Okay.
Symbiocord,
Okay.
those type of things are not designed to use when you are having an asthma attack. It's a preventative measure. So you're going to use that when you are waking up in the morning or however your doctor prescribes for you to take the medicine. It's to keep you from having those attacks, just in case you come in, contact with a trigger or something that causes an asthma attack for you. I see a special doctor called a pulmonologist. She is a doctor that studies the lungs, and she makes sure my lungs are healthy, happy, and in good shape. So this doctor specifically deals with asthma, all right? Lungs, heart, those type of things. He or she specifically deals with kids that have asthma, all right? And this would be the type of doctor you'd like to see if if you have this disease, with a referral from your pediatrician or your primary care physician. I also have an asthma action plan that gives detailed instructions on how to care for my asthma in case of an emergency or when I am away from mommy. An asthma action plan looks something like this. And I have a copy case, right, that you go over with your doctor, and your doctor will write instructions for you in case there's ever an emergency, right? So the red zone is going to be the danger zone, the caution, yellow zone is going to be the caution zone, and the green zone is going to be, okay, the most safest zone out of the 3 zones. If you ever get in red, time to go to the hospital.
Do you give that to your child's school?
Yeah, you can give this to your child's doctor. Your doctor will fill that out, and then you have this with your child's asthma medication given to the school, and this will be the plan that they follow.
Okay, perfect.
And then whenever they're away from you, if they're with dad or if they're with grandma, whomever, this action plan needs to be with them.
Okay.
And a lot of times doctors will fill this out. If they've diagnosed a child with asthma, they'll fill it out and have it in your file, so that you can just print it out and give it to the schools or the sports clubs or after school clubs or what have you. I have asthma, but asthma does not stand a chance with me because mommy takes good care of me. You can defeat asthma. The end.